Greetings, everyone, and welcome to the Change of Shift podcast, where nursing meets the internet. I am your host, Shawn, and I am pleased to announce I have a guest today, my good friend and family physician, Dr. Mike Sevilla.
Welcome. Hey, Shawn, how you doing there, buddy?
I'm good. You know, I always end up pronouncing your name 7 different ways. Is it Sevilla or Sevilla?
It is Sevilla. And actually, my dad from the old country in the Philippines says it's actually Sevilla, but he Americanized it. So we go by what dad says.
Because ironically, I have a physician colleague that I work with that has a name, if I'm not mistaken, exactly spelled like yours, but his is pronounced Sevilla. So I apologize if I accidentally say that, because I say his name 10 times a day or more, and every time I read your name, I think of his name. So
you only say my name in vain there, Shawn. I know.
So this is a off-topic or spontaneous podcast that we're going to broadcast, as well as I will post on the Change of Shift podcast. We're going to talk a little bit about my past experience over the week. Normally, I release a podcast every Wednesday, but we're going to go ahead and change things up a bit. Before we get to the subject at hand, those of you who are just joining my podcast for the first time, thank you for joining us. And for my frequent listeners, thanks for coming back. Change of Shift podcast. The goal of this podcast is to solve problems, review topics, and share actionable information that encompasses the professional and personal lives of healthcare professionals and nurses. You can subscribe, download, and listen while I discuss current events, impactful stories, and invaluable lessons from the front lines of healthcare. Welcome, everyone. Mike, thanks again for joining me.
Oh, it's always a great time with you there, Shawn.
If I'm not mistaken, I think this was your idea.
No. Talking with Shawn on a podcast, man. That's
no, we've only done this a few dozen or more. Kind of ironic that you and I have been blogging for a long time. You are the seasoned podcaster, and while podcasting is still brand new for me, it seems like I've been doing this forever. So I guess it's a good thing. I don't know.
We're still trying to discover that.
So I usually talk about my previous episode, but we're going to go a little out of order. So I'm not sure if this episode will be released before this coming Wednesday or not. So, podcasting 101 error faux pas is to not date your podcast, but I'm doing just that. I'm dating my podcast. So for those of you who have followed anything about me out on social media over the past several weeks, you should know, or if you don't know, let me share it once again, that I suffered a very significant knee injury while I was on vacation. Poor me. On vacation in Cancun, Mexico, and once in a lifetime experience opportunity to visit a cenote, is what they're called. Had to look it up at the time.
Cenote.
Cenote. And it's spelled with a C, C-E-N-O-T-E, cenote. And what it is a natural spring that is now where I was at in Chichen Itza. I'm going to spell that wrong. I'm probably going to hack that all up. Short version is that you could jump off of a short cliff, and I say short as in 15 feet. You could jump off of this cliff into this well of water, which was 150 feet deep. And being the active person that I am, I had to try it. Jumped in the water, and upon impact knew something was wrong. Something was up with my knee.
How did you know that there, Shawn?
this ridiculous shooting pain in my knee that felt like somebody bit it off, or at least shot me with a gun. Couldn't actually use my leg. Jumped in the water, and when you resurface, you go from going down to going up. When I stopped myself to go back up to resurface, I couldn't do it. My leg decided to not work because of the searing pain in my knee. Took everything in me to doggy paddle back over to the side and to get out of the water, and could see immediately that my knee was not the same size it was when I entered the water. Got a couple guests here that I'm ignoring. So, Jim, thanks for joining us. Disclaimer, as always, I forget this particular podcast is being recorded on the Blab IM platform. So we have some active guests here from the Twitter world that are joining us. So I will try my best to explain who and what I'm talking about to my recorded guests who will catch this podcast at a later date. Jump in the water. Ouchie pain. Got out of the water. And then had to hobble around Cancun, Mexico for 2 more days before I made it home. Knowing enough about medicine and sports injuries, I knew I had screwed up my knee, suspected I had a meniscus injury or at least a lateral ligament injury. Saw the doctor on Monday, had the MRI on Tuesday. Normally, now, Mike, you can attest to this. Normally, when the patient goes and gets an MRI, first of all, the MRI usually takes a significant amount of time to schedule. Okay, yes. So that was my first piece of luck, is that I went on Monday to see my doctor, and on Tuesday morning, I had my MRI.
Oh man, yeah. So did you pull a Sean P. Dent? Did you do you know who I am?
No, I did not.
I was Sean P. Dent on Twitter, and he said, "Okay, we'll do it tomorrow."
It was actually complete luck. So Katrina is right. Who's in the Twitter stream? It was absolute luck. I also might have given my pouty face a couple times.
There.
Yes, that's my pouty face a couple times.
Mm-hmm.
So that was my first piece of luck, that I had my scan done almost immediately the next day. Now, second piece of luck is that you know as well as I do, Mike, that a patient gets a MRI or any other outpatient imaging study. How long does it take for you to get the results of that imaging study?
I don't know, a few days, sometimes a week.
Right. So you're lucky if you get it in 48 hours. They called me within 3 hours.
Because you're Sean P. Dent on Twitter.
I don't have an answer as to how that happened, okay? But I had the MRI at 8:30 in the morning. Speaking of which, I was early, so I actually had it done earlier than 8:30. And by 1:30 p.m. that afternoon, excuse me, the doctor's office calls and says, "Sean, we have the results of your MRI." And I was equally excited and scared, because that can't be good. So, come to find out that I had a lateral meniscus tear across the entire body of my meniscus from the anterior down to the posterior horn. Of course, ridiculous effusion and edema. And then there was a quote unquote foreign body in my knee joint. So Sean, kind of back up a little bit for our non-medical audience, if you could. Yes.
If you could explain meniscus and effusion and all that stuff there.
So the easy one, effusion just means swelling. Effusion is swelling within the joint space, and this joint space happens to be my knee. Your meniscus are what we like to call shock absorbers. So they're this really cool tissue that is squashed in between your upper leg bone and your lower leg bone. So in between your femur and your tibia is your meniscus, and you have 2 of them. You have a medial and a lateral meniscus. I won't go into any more detail other than they serve as shock absorbers, so that when you jump from a height, or even when you take a step, Those shock absorbers help to disperse the weight from your large upper body and femur to the smaller lower bodied tibia. So that's how we can last, and our bones can last as long as they do, upwards of 7 centuries, decades, Jesus. Why that you can walk upright for upwards of 80 years if you play your cards right. Look at that. Dropping the WebMD links. Look at Mike go.
I got your back, man. Keep going.
Thank you. So, thank you for reeling me back in there. So, what that means is that I had a significant injury that needed to be seen by a specialist being the orthopedic surgeon. So, luck number 3, talked to my primary care physician's office, said, we'll get you in so-and-so time, so-and-so date, and they wanted to have me see an orthopedic surgeon in like February, which was the earliest they could get in.
Which is not surprising.
No, it's not at all.
Given our broken healthcare system, Shawn.
Yes. So here's where knowing people helps. The reason why I can't wait until February to have my knee taken care of is because since the injury, since my vacation, I am unable to work. My knee was locked, and I mean fixed, in a flexed position. So imagine not being able to straighten your knee and how that affects your everyday life.
And you can't even drive.
Nope. Can't drive, can't walk, can't go up and down steps. Using the facilities is actually a challenge. Yeah. I'll let your mind race with that one. But
Thanks,
Jimmy,
Shawn.
yeah. So this was I wouldn't say emergent, but extremely urgent to get taken care of. So made a few phone calls, begged, bartered, and maybe sold my soul to the devil, and got to see one of the premier orthopedic surgeons in my area within a week.
Nice.
So,
nice.
Yeah. So it was the first time in my healthcare career that I pulled the card, what's the term you want to use? I'm in healthcare, you're in healthcare. Maybe I can call somebody else who's in healthcare, and maybe they can pull a couple strings. So, big barter and sold my soul.
So and when you do go back to work, you're not going to be taking a vacation for like 5 years.
No.
Yeah.
So, saw the orthopedic surgeon. Now, this is get the diagnosis, and a week later, I have to wait to go see the orthopedic surgeon. And in that week's time, all I could think about is, what am I going to do? How is this going to get fixed? And knowing the little bit I know about medicine and everything that goes along with it, I knew I needed surgery. The interesting part of injuries to your meniscus is that not all of them are actually needing surgical correction. So there are a lot of times where you have a meniscus injury, and you can even have a meniscus tear, and they want you to wait it out. They want you to do rehabilitation for a month or 2 and see how that goes. And
of course, they gave you that option.
No, they did not.
Oh, did not. They're like, you messed up your knee so much that there's no option for you. We got to put a scope in there.
Absolutely. That is exactly what happened. So I got lucky.
Nice.
But in that week, all I could think about was, I'm going to have an argument with an orthopedic surgeon because I'm going to demand that I have the surgery done, because I didn't want to wait any longer than I'd already been waiting.
Right.
So saw the orthopedic surgeon, and it was the quickest visit ever. He saw that because I already had the scans done. He already knew the back end story. I walked in. He asked me the story. I told him. He paused, and he said, well, I think you need surgery. And and that was it. It was this is the point where, you you spend all the money to be that guy that can walk in and in 2 minutes charge you for an office visit and charge you for a surgery. And all I had to do was basically look at a scan.
Nice.
So
Nice.
no, he was very good about explaining the process to me, because of course, me being who I am, I had a bazillion questions to ask. I wanted to know how long therapy was going to be, how long I was going to be off, when can I start exercising, when can I go swimming, because I know that past experiences, I know that aqua therapy is going to help me. I want to know when I get back in the pool, when I can start lifting weights, everything. So he explained it all. And he said to me during my office visit, he said, there's two things that are going to happen. You have what's called a bucket handle tear. I'll let you guys look that up. Bucket handle tear on your meniscus. There is, now my wife says he said 5%. I think he said 1%. He said there's a 1% chance that your meniscus is repairable. Most of the time, meniscus injuries mean we go in, we look at the scope, it's too damaged. It would basically cut away the damaged tissue, and you'd have what's done is called a meniscectomy. We take away the damaged tissue so that that tissue doesn't cause you problems in the future. That means you lose part of your meniscus, which is bad. Motto or the actual MRI? He actually, sorry, my fans and listeners. My good friend Jimmy, Mr. James Ligon, is also a physician out in Montana. Is that right, Jim? I think it's Montana. I could be way wrong. I apologize if it is.
I think you're right there, Sean.
He is asking a question. He's asking if the surgeon used a good. I was right. He is in Montana. He asked if he explained the surgery using a model, which is you can use a live model, 3D model, or did he actually look at the MRI and explain to me on the MRI? So the answer is twofold. One, I requested to see the MRI, and two, he wanted me to see the MRI. So me being the nurse practitioner, I wanted to see my own MRI. I wanted to see what it looked like. So it's not only for my own personal diagnosis, but it's also to sharpen my skills of, looking at an MRI as a practitioner so that I can see what damaged tissue looks like. So never stop learning, gentlemen. Never stop learning. So where was I going with that? So he's telling me what I need to do. He's telling me that there's a 1% chance that you could actually have it repaired. And I said, okay, what's that mean? If we cut your tissue away, you're up and moving and you're walking within 2 days. Basically, you're on crutches just to get past the acute phase, and you can start walking as much as you want. If we repair it, meaning that we actually suture the tissue back together and we anchor it down, you're going to be on crutches for upwards of 4 weeks. Those were his words, upwards of 4 weeks. And quite honestly, at the time, all I thought was fix surgery now. I don't really care about rehab.
Right.
I just want to get it fixed. I just want to be better. Lo and behold, I was the 1%. Lucky me. So week went by, and as of it is now Saturday, and once again, we're doing a podcasting faux pas.
Faux pas.
Faux pas.
Don't do
It's
this at home.
Saturday. I'm doing it.
We're professionals.
Saturday, January 16th. I had my surgery on Tuesday, January 12th. I had to look at the calendar on the wall. Days are all mixed up. And I, lo and behold, did have a meniscus repair. So I ended up being the 1%. And it took me 2 days to process the fact that took me another 2 days to process the fact that I'm going to be on crutches for 6 weeks. So good and bad.
How did it get to 6 weeks?
Yeah, so he said up to 4 weeks, and then I was told by his physician assistant who was in the OR during the surgery that they want the tissue to be fully healed. So
you heard this after surgery, or did you hear this
after surgery
at a post-op visit or something like that?
No. I made a phone call. So I made a phone call.
Oh, so they told you over the phone, so you couldn't strangle anybody.
Exactly.
Right,
So
right.
they had given me the post-op instructions. They had given me the cookie cutter post-op instructions of, the meniscectomy. So you can be up and walking in 2 days if you feel okay and it doesn't hurt. And I remember distinctly someone telling me, "You're going to be on crutch. You can't use your leg until you go to your follow-up appointment, which is in 2 weeks. Follow-up appointment with the PA." Okay, no problem. I'm seeking clarification. So by seeking clarification, I made a phone call to my orthopedic surgeon's office, and the PA actually called me back that night, and left me a voicemail, and ended up talking to him the next day. Really nice guy. He said, "Oh, no. You're gonna be off that leg for 6 weeks, Shawn." And I almost dropped the phone. And I said, "Excuse me?" Yes, Jimmy, I'm one of those patients. Jimmy, who's in the Twitter chat rooms, telling me I'm one of those patients. Yes.
So, I can only imagine the amount of cursing in your head that was going on, that you were trying to filter yourself from saying on the phone. Is that correct?
I didn't filter anything, Mike. I said what I feel.
So you're swearing on the phone to this guy, saying, "What the 6 weeks?"
Yeah. In my own words, I can say it. I was like, "What the fuck are you talking about? You gotta be shitting me."
Do you know who I am? I'm Shawn P.
Yeah,
on Twitter.
kidding. And yeah, so of course I dropped the phone and text message everybody I know, and had to re-educate not only my family and friends, but I had to break the wonderful news to my work.
Your boss.
Yes, my boss, who thought maybe. So the ideal situation from a return to work perspective would have been surgery, up and walking 2 days, rehab, aggressive rehab, because I can do most of the rehab on my own, if not all of it.
You could do rehab like in your house.
Yeah, I can do rehab in my house. I also have access to a gymnasium 24/7. I also have access to a pool. So in my mind, my original time frame was, I'm going to be well enough by the end of this month that I'm going to be back to work before February starts.
Exactly.
And I had to make a phone call to my boss and say,
"How'd that go there? How'd that go there, Shawn? Can you?"
There was a long pause.
Yes,
a long pause because being professionals. My boss can't swear at me, at least not on the phone.
Not on the record.
No, can't do that on a recorded device. Unlike a distraught patient, I can say that.
Right, exactly.
Anyway, yeah. So that was a hard pill to swallow.
Yeah.
But ultimately, I'm happy because I'm a very active person. I might be 42 years of age, but I'm not sedentary in any way.
No.
I am very active.
Yeah.
I do a lot of running, jumping, hopping activities. I do CrossFit. I do Olympic weightlifting. I like to go hiking. The list is endless. And to be able to salvage my injured meniscus means that I'm going to extend the life cycle of my knee, because had I been the other 99% and had my meniscus, that piece removed, I would be limited because it would catch, it would have pain when I would do certain movements because that shock absorber would not be there. It'd be gone. So it'd be, instead of a shock absorber, it'd be bone on bone. It'd be my femur grinding on my tibia. And you can just imagine in your head that that's not a pleasant feeling. So while I'm very frustrated right now because I have to be on my crutches for 6 weeks, in the long run, I'm very thankful that that was the outcome.
You mind if we take this in a little different direction there, Shawn?
Go for it, my friend.
So the title of this is When the Nurse is the Surgical Patient. What if you could share with us kind of the surgical patient part, and you can start wherever you like.
All right. Well, let's start with a little bit of backstory. For those who don't know me, and for those of you who do, I apologize because I repeat myself a lot. I'm an acute care nurse practitioner. Excuse me, I've been a nurse for 10 years. I've also been a certified athletic trainer 10 years prior to that. My experience as a nurse has taken me working in the ICU for 99% of my career. The other 1% of my career, I actually worked in recovery. I worked in the recovery room, or the PACU, which is the post-anesthesia care unit, the area where people who come from surgery go to recover from the anesthesia medication to wake up and to go about their business. Worked there for 2 years and actually moonlighted in the operating room itself. For a very short time, I worked with an orthopedic surgeon. This is where the irony comes in. I worked with an orthopedic surgeon for about 6 months. I was his first assist in the operating room. So I actually helped perform the surgery that I had done on me when I was a newer nurse back in 06, 07.
Did they let you hold the camera?
I actually got to suture it closed. Yeah, and I actually got to hold the camera, but I was a little nervous about that because, camera's a little, that's a, I don't want to go screwing something up like that. So
no, I got yelled at a lot holding that camera when I was a student. They were like, "What are you doing?" I said, "Sorry, ma'am.
Exploring.
I had a little bit too much coffee this morning, ma'am. So please don't kick me out of the OR."
So that's my history, is that I have firsthand working knowledge of taking care of surgical patients. So lo and behold, I became one of those patients. So you can imagine the level of anxiety that I created for myself.
Because Shawn, you weren't imagining all the perfectly performed cases that went out without any kind of problems at all. You were probably imagining every single potential complication that you saw or you didn't see going into the surgery. Would that be accurate there, Shawn?
That would be very accurate, my friend.
Yeah.
Very accurate. Yeah. It's one thing to hear stories or to read it in the news or to hear it from a colleague or a friend or a family member. It's a whole nother story when you actually experience it firsthand, when when things go wrong in the operating room, So my anxiety level was through the roof. But you also have to trust those who are caring for you. And I consider myself to be a little bit of a bigot if I'm going to ask patients to allow them to trust me to care for them, and I can't do the same when, the shoes are on the other foot, when I'm actually the patient this time. So, but it was a very interesting experience because, I had two people in my brain. I had the patient on one side and I had the nurse practitioner on the other side, just having arguments back and forth over what will happen. No, this, what could happen. What will happen, this could happen. So, yeah.
Now, you had this surgery, Shawn, in your kind of own hospital system, but not in the hospital where you work at. Is that right?
Correct. So I had it in the surgery center. So, and I'd never been there. So that was a new experience for me because I work in the hospital. I live in the hospital. So this was a new experience for me.
So did you know any of the providers, nurses, all that stuff who were taking care of you and telling you to calm down and all that kind of stuff?
So I thought I would not, because I'm in a different building. I'm in a different arena. I'm not in the hospital in the inpatient side. I'm in the outpatient surgical center. And I thought, and it was kind of a comforting thought, nobody's going to know me. Good to go. I'm safe. And lo and behold, I ended up recognizing and knowing over a handful of people.
Now, I mean, when you knew that, you're probably a little anxious, but looking back on it, are you glad that you knew those people and those people knew you?
Absolutely. Absolutely. I think I admitted to it a while ago, either on my Snapchat or maybe I admitted it on one of my blog posts, but whether they consciously or subconsciously did it, I'm imagining they probably gave me a little bit of extra attention because I was a fellow healthcare professional, because I was a quote unquote coworker.
Right. But in your mind, you're probably kind of critiquing everything, because part of your real job, is that you're starting IVs and things, and part of this surgery, before surgery, is you're starting an IV, and you were thinking in your mind, oh, why didn't they hit it the first time? Those people, they're trying to make me suffer, and I mean, all that stuff is going through your mind, right?
No, I was actually saying those things out loud.
You should have periscoped the whole thing. Would have been awesome.
I was actually saying those things out loud to everybody, and my wife's not here to vouch for me, but yes, I tried. I couldn't do the Periscope thing. There were too many things going on, and quite honestly, it was such an efficient machine. It happened so fast that I didn't actually wait very long. One of the biggest complaints that everyone has is the wait time you have for anything, whether it be for a test or a procedure. I was having surgery, and this is not an exaggeration. From the moment I stepped foot in the building to sign my name to check in, to the moment I was discharged and sat in my car to leave, 4.5 hours had processed. Mm-hmm. So in 4.5 hours, check in, paperwork, pre-op, screening, IV started, med started, in the OR, out of the OR, PACU, recovery, dressing changed, out the door. 4.5 hours.
Wow.
I don't know if you've had any experience with that, Mike, or your patients have spoken of experiences like that, but I don't think that's common.
I don't know. I mean, obviously it's procedure dependent. It depends what kind of stuff people have had done. But there are a lot of surgery centers, even in the hospital too, that, granted, not to that amount of efficiency, but they've learned to become more and more efficient. So I'm glad you had a positive experience there.
Thank you.
Did you feel, do you remember anything about coming out of anesthesia or anything like that?
Oh, I remember the whole thing. I remember everything. The parts that I wasn't supposed to remember, I don't remember. So my hat's off to the anesthesia team. They did a almost perfect job. So like you had mentioned earlier, I knew most, if not all, of the anesthesia team that was taking care of me. In fact, full disclosure, there was actually individuals that I trained. So, I knew them not only from the patient perspective, but I actually worked with them side by side in the hospital, which was nice.
Oh, you helped teach them.
Yeah.
They're like, the old man's here.
Yeah.
Which
was comforting.
We're gonna show him everything that he taught us there.
Yeah. But I did the same thing every other. Now maybe it's just nurses. Maybe you can give a different perspective on this one, Mike, since you're a physician. Is that when you are a nurse, you critique everything a nurse does.
Oh yeah.
When you are a patient.
Yeah.
Whether you like to do it or not, whether you do it on purpose or not, you critique everything they do, everything from the moment that you are introduced to them to the moment you leave. Everything from their mannerisms to how they speak to you. And then when, and I wish I would have periscoped this or at least Snapchatted the moment when my pre-op nurse, my intake nurse, was told that I was a nurse practitioner. Because the look that you give that patient when you realize, oh, you're a nurse. Exactly. So for those who are not viewing this right now, Mike's giving the, oh my God, look.
Yeah, like, oh, that guy.
Yeah. So full disclosure, I decided ahead of time that I was basically just going to say what I feel so that I don't accidentally say something under the fog of anesthesia. So, yeah, but why the pediatric Foley? But good one, Jimmy. You know, because I'm fairly athletic, and if you've ever looked at any of pictures of me, starting an IV on me should not be difficult. I have pipe cleaner for veins. It's very easy to find an IV on me. So when my nurse was starting an IV on me, of course, I had to play it up. And it came down to, a challenge more than anything else. I tell my nurse, if you miss starting an IV on me, what that says about you as a nurse.
Wow. Oh my gosh. And they're like, we'll see you when you're asleep there, Shawn.
Yeah.
Sleep.
So that nurse was a good sport, and they ended up nailing it. She nailed it on the first try, so she was rocking it.
Nice.
Nice. I don't care what anyone says. IV starts hurt, man. I don't care how good of a stick you are and how seasoned you are, man. IV sticks hurts. Getting poked with a needle hurts. I mean,
which brings me kind of to my next tangent, which I told you that we're going to talk about is, now that you've, been through this patient experience, and probably when you go back to work in 6 weeks, it's going to feel like
I only get off my crutches in 6 weeks. So that's what I mean. I'm not getting back to work for like 2 months.
I assume there's going to be some of this experience that you're going to bring back to, your job and being an acute care nurse practitioner and having that kind of patient perspective. Even as simple as something that before you were like, oh, sorting IV, that's no problem. But now that you had the experience, there's probably other stuff that you're going to, bring back to your job.
Absolutely. Every aspect of this experience I will take back with me to my practice. While I don't have a lot of experience, or I don't have a lot of interaction, my primary job, my primary role doesn't have a lot to do with outpatient procedures, doesn't have a lot to do with home care, has everything to do with inpatient care. But I will definitely be utilizing my personal experience when it comes to something I used to consider to be simple as discharging a patient home or transferring a patient from the ICU to another unit. I'm going to mind my P's and Q's about some of the simplest of things, because rehabilitation, while it's an easy word to say, is absolutely challenging in every way. So my whole experience has given me a new appreciation for everything I do as a provider. From the moment that you give somebody a diagnosis, to how you treat them when you talk to them about the diagnosis, to explaining things on their level when you are giving them their information, sharing all the information you can with them in a timely manner, especially. We talked about it earlier during this show, is that a lot of the things that I've experienced are not common, meaning that from the moment I got injured to the moment I got to see my doctor was one day. The moment I got see my doctor to my MRI, one day. And the moment from MRI to a specialist was less than a week. And that's unheard of. And I can't imagine the frustration I would have had I would have had to wait the normal wait time.
Right.
It's now January 16th. I injured my knee on December 25th. Had I followed the normal time frame that is, I don't want to say standard, but common, I might have just made an appointment with the specialist at this point.
It was on Christmas.
Yeah. You didn't know that?
I knew it was around that time. I was not.
It was on Christmas Day.
On the day.
Yeah, wow. Yeah. So I spent my Christmas day. Well, I spent my Christmas night miserable. Yeah, it happened approximately 4:00 on Christmas Day.
Wow.
4 p.m. Wow. So we went and visited the Mayan ruins at what's called Chichen Itza. I know I'm mispronouncing that. And then we went to we went to this cenote, and if I'm not mistaken, it's spelled "ill kill cenote."
Nice.
Go figure the joke in that one. So
we talked about this before the show, but I'm going to drop this in the chat room here. So you wrote about this experience, my first surgery, and I'm still the worst patient. Talk about that post and talk a little bit about what you've been doing afterward. Talk about your Snapchats and your scopes and things. What you've been doing with all your free time there, Shawn.
So I'm welcoming Janet into the Twitter chat room. Janet wants me to tap dance. So no thanks, Janet. I could hop for you. So Mike, I decided that my perspective on this surgery was unique because not only was I a nurse and a nurse practitioner, but I was also a former athletic trainer who was suffering a significant orthopedic injury. So I decided to chronicle, document, and share my daily experiences on everything that's been going on. And you and I had talked about this off the record. I thought maybe I would just, share a blog post every day about how my day went. Today was this, and I did that, and, I chronicled some pictures and some videos. And our good friend Drew had suggested using Snapchat. At the time, I'm like everyone else. I thought Snapchat was for the tweeners and the 20-somethings, and it was for the not so nice things to share. And Snapchat has evolved into something completely different. And I'm utilizing Snapchat now to share my personal experiences with my fans and my audience from a personal level. Not only do I get to catalog it in real time, but I also get to have conversations with them that I wouldn't been able to have any other place, because you can actually have FaceTime chats, you can do text messaging chats, and you can do it in real time at the moment. Granted, you could probably do that on Twitter to a certain degree, but Snapchat gives you a unique perspective because you don't get time to edit it. And whatever I share on Snapchat only has a 24-hour shelf life. So 24 hours after it's shared, it disappears.
And you even put stuff like, changing your dressing the first time and for people who don't know, I mean, Shawn, I think even right now has this huge, enormous brace, not on his knee, like on his entire leg.
Yeah.
And he shared that on Snapchat.
Yeah. So you don't realize when you have the knee surgery that you have to be in an immobilizer. And my immobilizer actually spans from just below my hip, upper thigh, all the way down to my ankle. And for my particular surgery, I'm allowed to fully extend my knee, which is lock my knee out and straighten it, but I can only bend my knee 30 degrees in flexion, and 30 degrees of flexion is not a whole lot. So I'm sharing all of these things. Should I be laying down? No, actually, I'm doing okay.
Actually, he's laying down right now. You just don't know.
We could talk about that a little bit, Janet, though. The reason why I'm still the worst patient is that I spent this entire week talking about all of the things patients should do. Everything from post-surgical management to how you treat your healthcare providers to managing your post-operative pain effectively. And I've been utilizing not only Snapchat and my traditional blog, but I also been using Periscope. Our friend Jimmy, who has excused himself from the Twitter chat, introduced us to Periscope. Janet, I was. Janet Kennedy's in the Twitter chat. She's saying that I wasn't nice. Was I not nice to my nurses? And I was. Janet, if you missed the about 10 minutes ago, we were talking about I used a lot of sarcasm and I was very transparent about my feelings, but I was not mean to them in any way. I was very sarcastic though, because any nurse will admit to feeling the exact same way I do when they become a patient. So, yeah, Mike, using Snapchat, using Periscope to try and not only share my experiences, but to educate others. And others could be nurse-to-bees, someone who's interested in nursing, someone who is in nursing school, currently practicing nurses, also patients and providers, to get a first-person view of what it's like to experience this surgery. And one of the comical things is that I did a Periscope on proper pain management post-operatively when you have a surgery.
Interesting.
And I went in depth about basal rate fluctuations, that you're going to have this basal pain that goes nonstop. You're going to have these peaks and valleys of pain depending on your activity level. Janet's asking in the Twitter chat, do I have a better appreciation for the happy face pain chart? I think I could rewrite the happy face pain chart now. So Periscope that I did on proper pain management post-operatively talked about staying ahead of your pain. Mike, you and I have educated patients ad nauseum about, even though when you have a surgery and you're given pain medication that is actually prescribed as needed or per diem, and you can use it as needed every 2, 4, 6, 8 hours, that for the first 48 hours, you should take it in a scheduled manner. As long as it's not causing any severe side effects or causing any negative things to happen. For instance, if you're sick to your stomach, or you're having severe constipation, or if you're unable to do certain activities in your life because of taking this pain medication, by all means, you need to back off. But if you can, you should treat your PRN as needed pain medication as a scheduled medication. And the reason why is that you need to get past the acute phase of the surgical procedure itself, meaning somebody stabbed you with a needle, cut you with a scalpel, and then, for me, being the orthopedic injury, went in and took tools, snip, cut, scrape, basically turned your knee into a carpentry class. And all of that is going to cause ridiculous, constant pain for at least 2 days, regardless of what you do. You could be lying still in your bed and just breathing, and you're going to be in pain. So you need to treat that pain for 2 days, regardless of how you feel. Because the other caveat, and I talked about this in the podcast, is that they give you what's called a local anesthetic. Meaning, for me, in my knee surgery, they actually stick a syringe needle, yay long, into your knee joint and actually inject numbing medication, usually lidocaine or a version of lidocaine, into your knee. Yeah, into your knee to numb up all that stuff they did in there on purpose, because it's gonna hurt like a son of a bitch.
Wow.
I ignored all of my own advice. Ignored it all. Wasn't paying attention. Got home. Felt like Superman. Felt superhuman. Was up moving around on crutches, on the computer, on Periscope. And about 6 hours after I got home, when the local anesthetic wore off, and when the pain medication that I'd taken when I left wore off.
Were you sleeping?
No.
Okay. So slowly take us through the realization.
It was kind of like
were you like watching TV? I mean, obviously you're watching TV.
I was sitting on the couch. My wife was preparing dinner.
Yeah.
And I'm sitting on the couch, and I think I'm either doing something on Snapchat or I'm on my laptop. I don't know what it was. And it was like, let me see if I can describe this well.
That's good. Yeah, go slow. This is going to be really good.
I'm trying to determine what's the best. Oh, okay. I got it. It's like a brain freeze when you have ice cream. Okay. scoop of ice cream. It feels great. And then there's this insidious, like, little tickly, burnily feeling in the back of your throat. And then it starts to creep up the back of your neck, back of your throat, roof of your mouth. Still feeling kind of tingly, kind of odd.
Yes.
And then all of a sudden it's like someone smacks you on the back of your head and your whole face, eyeballs start burning with this searing, freezing pain. That's kind of what happened with my knee. Sitting on the couch, like feeling this like insidious, like little, it's like an itchy feeling inside my knee, right under my kneecap. It's like, I don't feel good. Maybe I just need to reposition my knee. That's it.
Yes.
I just need to move my knee.
Yes,
So let me reposition, slide my hip around a little bit.
Yeah. That's good. Yeah, take us through like those initial steps, and then you're like,
let me pick my knee.
I need pain medicine.
No, that didn't work.
And it's getting worse. It's getting worse.
So it's getting a little bit worse. Like, okay, now it's like on the back of my knee too.
That's so weird. I can't believe that.
What's up with
What's going on? Did they mess up? They messed up the surgery. That's what happened.
You know what? You know what it is? Maybe I need to take my legs off of the pillow.
Oh, it's the wrong pillow.
I've elevated my legs too high. That's what I need to do.
That's the problem. That's the problem. Nope.
Let me take those pillows out.
No, it didn't work. No.
Having conversation with my wife, dinner this, dinner that, talking about mother, grandmother, blah, blah, blah. Oh, that's still not feeling very good. Now the pain's starting to like creep down my calf.
Right, exactly.
I can feel it down into my heel. So I'm starting to do this with my calf, the ankle pumps. Maybe I need to do ankle pumps.
Because you told people to do that before.
You need to do ankle pumps.
That's your advice to people.
Need to do the ankle pumps. Exactly. Make sure you're doing the ankle pumps. Exactly. So maybe I need to do ankle pumps. Oh wait, that hurts. Why am I doing that? Don't do that. Ankle. Note to self: ankle pumps hurt.
Yes.
Stop that.
Okay.
Maybe I need to straighten my knee a little. Oh no, not going to do that either.
No.
All right. Maybe I need to get up. That's what it is. I need to get up.
You got to put weight on it. Yeah, you got to get up. You got to work. You got to walk it off.
I need to shake it off a bit. That's what I need to do. So I need to get off of the couch.
Sure.
So I pick my leg up.
Yes.
Bring it off of the couch.
Boom.
Stumble over to my crutches.
Yes.
And I, hobble into the kitchen.
Yeah.
And I have the pain face. I have the pain painted on my face.
What's the pain face look like there, Shawn? Right. Okay. And you're looking at your wife, right? Yeah.
Ooh. So at this point, the pain receptors are taking over every other bodily function in your body.
Right.
My brain is starting to shut down.
Right.
Because all I can think about is, please stop the pain in my knee. So the conversation that my wife is having with me is just, it's turning into Charlie Brown. Wah, 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 wah. Things are getting a little foggy. What the heck is going on with my knee?
Right.
And I don't know if I needed to be told, or maybe my brain finally made the connection. You had surgery. You might be hurting from surgery.
Oh.
Maybe you should take a pain pill.
No, you can't be weak like that, Shawn. No.
I don't need a pain pill. I'm good. Hold on, wait a minute. No, I'm okay. I just need to walk it off. So my wife turns and looks at me, and my wife of 10 years doesn't even ask me a question. Looks me dead in the eye and says, "Take your pain medication."
And you said,
and I said, "I hurt a lot." So I had to hobble back to the in the meet. I forgot to mention, I skipped the part where when I was on the couch, I thought to myself, maybe I need a bag of ice. Maybe I should put
Ah,
ice on my knee.
yeah, because that's what you tell people.
I need to put ice on my knee.
your
So
ice
I
on
asked for it. I had asked for ice on my knee.
Right, right.
This whole process must have lasted a good 20 minutes.
Mm-hmm.
Shifting, changing, denial,
Yeah.
bargaining.
Right.
Was that dabda? Dabda?
Yeah.
Denial,
Yeah.
anger.
Mhm.
Take your pick.
Mhm.
Finally ended up taking, so then I only took one pain pill. So, they give you the take one or two as directed. The prescription on the bottle says take one or two. So I took one.
Of course.
I only need one.
Exactly.
I only need one.
Exactly. Right.
I take my pain pill. We eat dinner, and I eat dinner in the most miserable fashion because the pain's not going away. Dinner's done. Wife comes back to the couch.
Yes.
How you feeling? I'm not feeling much better.
Oh.
Well, did you take 2 pain pills? And I'm not kidding you. I actually said this. I can take 2.
Oh my gosh. Yeah. Because Sean, they told you during your discharge instructions, because everybody should be paying attention to the discharge
because I
instructions.
paid attention to that.
Exactly. So you should know that you could take 1 or 2.
I could take 2? Yeah. Now, my wife, who's also a registered nurse, is looking at me like, are you that dumb? So ended up taking the second pain pill and spent the remaining evening, the first night of my surgery, chasing my pain, getting my pain level down to a manageable level. Yeah. So it was probably another 6 hours before my brain could think straight. So, because that was real pain, and I thought the pain I had experienced the minute I'd injured it, I thought that was the worst pain that I could have, because that was fairly significant. And this post-op pain trumped it in every way.
Yeah.
Trumped it in every way. So, needless to say, I learned my lesson.
And you see post-op patients in your unit sometimes, is that right?
Yes. I see post-op patients all the time that
they feel great, and then a few hours.
Yeah. Well, what's funny is I don't know if you follow Laura Scarborough. She's NICU RN Mama on Twitter.
Okay.
She's a NICU nurse.
Yeah, cool.
She has a blog, longtime friend on Twitter, and I think the next day when I had shared that I got behind on my pain, and her words were, I saw you last night on Snapchat looking like the hero. And I thought to myself, yep, local hasn't worn off yet, has it? So she called me on it. She called my bluff. And I don't know why. It's amazing that it's crystal clear when I'm the provider, when I'm the nurse taking care of the patient. Like, listen, dude, don't be stupid. Take this pain medication. I know you feel great right now, but this local anesthetic is going to wear off in an hour. And then the pain medication that you took 4 hours ago is going to wear off, and you are going to be in a world of hurt. And I couldn't take my own advice.
Yeah. Mm-hmm.
So I think maybe, and I'm willing to admit it, I think maybe I thought I was smarter than everybody else. I thought I was tougher than everybody else, and I don't need that. I'm good. I'm okay. Nope. To this day, this is day four, and I'm still taking my pain meds around the clock.
Good.
I'm not even going to think about backing off until probably Monday. That pain was unbearable. Yeah, I was not okay.
But you've been getting some decent engagement on Snapchat and Periscope, and I was able to catch a couple of those scopes live, and people coming in and interacting, and that must be a fun experience.
It has been. I'm trying to take advantage of the fact that I'm going to be laid up for quite a while here. So the Periscope thing was an experiment, and it ended up being addicting, because you and I have talked about Periscope a couple times, how, oh, I don't think I could do Periscope. I can't be the only person on screen. I can't be the only person talking, and I'd rather do it on Blab, or I'd rather see engagement with, Google Hangouts, blah, blah, blah. The Periscope thing is probably just for celebrities, people who like to hear themselves talk. And it was absolutely addicting. Like I did it. The first Periscope I did was the day of my appointment with my surgeon.
Mm-hmm.
The day that he told me. It was an hour before I went to go see him. And even back then, I was worried about being the patient, the provider who is now the patient, and having prejudgments about everything, because I knew I would judge him as well as judge everybody else. So, and I did the first one as a experiment, and it failed miserably. Charlene in the Twitter audience is asking what surgery I had done. I actually had, look at that. Mike's beating me to the punch there. I had right knee arthroscopic surgery. I had meniscal repair done to my right knee. So first Periscope I did, first of all, didn't even know how to use it. If you look back on my first Periscope, which is really cool, you can save all your Periscopes. Didn't know if you knew that or not, but you can save your Periscopes on a website called catch.me with a K, KATH.me, KATCH. Jesus, can't even spell, Mike. And I think I had 4 people come to the Periscope, and maybe they were, and from what I'm told, they were having conversation with me, but I had no idea how to talk back with them, and I had no idea to see what they were saying. So it was a major fail. And then I had a Periscope again a couple of days later with a little bit more engagement. Had a couple more people show up, and it was fun, because you start your Periscope with this particular topic, and then like we're here on this Blab, people start asking questions outside of the topic, and you have a meaningful conversation about things that they're interested in, from a tangent that started with the topic that you were talking about. And then I had a Periscope a week ago on Saturday. And quite honestly, I'd have to go back and look exactly what the topic was. I think it was about social media. If I'm not mistaken, I did a Periscope how I believe every nurse should have a social media account. And it exploded. It exploded so much that it was overwhelming. Like 900 plus people commented on it. 900 plus, over 100 plus people were on the Periscope at one time. It was insane. Oh, Mike, you lost your audio there, my friend. Not sure what happened there.
Because I muted myself because I was coughing.
Oh, there you go.
I put my own cough button on and I didn't turn it off. Oh.
So yeah, that Periscope is what really drew me in. So then I started doing Periscopes every day up until yesterday, I think. And it's just another way of engaging with your audience. It really is. You have to take it for what it is. Sometimes it's a complete failure and it's just you talking to a screen. And then other times you get a handful of people that come in and have meaningful conversations about the topic that you want to talk about. And I think you and I had talked about it a while ago that wasn't interested in Periscope because, like Snapchat, there was a shelf life to it. It disappeared in 24 hours. But that's been solved. You can actually save all your Periscopes that you broadcast on that platform called the Catch platform. So I utilize that platform to reshare those videos and those conversations on other social media platforms.
Now we see that Janet is here. So I saw, we talk about your experience on the Get Social Health podcast. I look at their website, which I'll drop in the chat room, like on the front page or at the top. How fun was it to be the interviewee something like
It
that.
was absolutely, it was beyond exciting. So Janet is a wonderful, wonderful host. Very good at listening and coaching her guests appropriately. She also was very spontaneous, which was nice. That she had a set number of questions she wanted to ask me, and then it completely veered off topic, which kind of made me feel good because I thought I was the only one that did that. And Janet parlayed that well into the interview that I had. So I can't thank Janet enough for the opportunity to chat about. And this interview was done prior to my surgery. So it was an interview to talk about my podcast, the Change of Shift podcast, as well as, yes, Janet, you're absolutely correct. Janet says in the Twitter stream that she's wants to have a real conversation, that she's not a journalist, and you hit the nail on the head with that one, Janet. You did an awesome job. So she interviewed me about my podcast, and then she interviewed me about my upcoming media ventures, business ventures. It hasn't been completely revealed, or should I say, I'm slowly letting the cat out of the bag with that one, is that I'm developing a media group. Haven't quite decided on the name. I keep going back and forth. Oh no, I'm ready to launch, Janet. It's already quote unquote launched. The question is, I just don't like the name.
Soft launch.
It's a soft launch. I still can't seem to like the name. I still, Janet and Mike and everyone else out there, I still suffer from the imposter syndrome. So trying to pick a name for my media group, my media company that encapsulates me. I'm open to suggestions from anybody in the crowd, anyone that's listening to this. At this point, I'm the cat's out of the bag now.
Well, I mean, now that's a great kind of tease because looking at the clock, I think we're coming up on 60 minutes. So,
oh yeah, look at that.
Maybe start to shut it down a little bit, and but hopefully, you'll. I mean, I know you will, but maybe we can have some more blabs as your post-surgery recovery continues there, Shawn.
Well, Mike, I thank you for joining me and letting me talk about my experience. I think you and I, as providers, as well as patients and former patients, have benefited greatly from having personal experiences like this. I didn't mention during our conversation earlier, but when I was an athletic trainer, one of the things that we were required to do in order to graduate from your program and sit for your national certification exam, at least where I went to school, is that you had to experience all of the therapies that you give your athletes.
Really?
So as an athletic trainer, when you do rehab and therapy, you administer ultrasound therapy, you administer electric e-stim therapy, you do iontophoresis and things like that to give medications and for therapies. Helps with tissue healing. And you had to experience all of those therapies as a student. Something as simple as icing a limb. You sprain your ankle, and Rehab 101 is to put your sprained ankle into a bucket of ice water. Yeah, good response. Good response.
Yeah, I was like, really? Wow.
Yes. So you submerge your ankle in a bucket of ice water. It's cold therapy, but you shock your ankle into slowing down or blunting the inflammatory process. And you, as an athletic trainer, have to experience what that feels like. So when you put your foot into that ice bucket for the first time, holy cow, is it a wake-up call? And I feel that every nurse, every provider, physician, advanced practice provider, nurse practitioner, PA, take your pick. Anyone that delivers healthcare should it have to be subjected to receiving the healthcare in some way. I'm not saying that in order to be a good doctor or a good nurse, you need to be sick and admitted to the hospital. I think you need to experience some level of what it's like to be a patient, because you will have a better understanding and you'll be way more empathetic to the care you give when you experience it.
Yeah, there was a movie back in the 90s, right around the time when I was, I think, in college or starting medical school, and it was called The Doctor, and I think it was about a doctor who, stereotypical jerk and all that kind of stuff, gets cancer and goes through that experience, and that was one of his things, and I think that was based on a book as well. It said that every provider should go through the experience of being a patient. And that was very impressionable on me when I was a college student and looking at medical school myself. And it was very impactful. And that's why I love stories like this, stories like yours, Shawn, that, has how it likes to be on the other side, your experience through it and what you learn through it and how you're going to apply that to your nurse practitioner job.
Yes. Yeah, I'm sorry, many of my colleagues, friends out there, followers, fans on social media have asked me, I think how I practice will change now that I've experienced this? And I think it will, to a degree. Like I said, what I'm experiencing now, I don't deliver that kind of care as a nurse practitioner, but I can appreciate learning to communicate better with my patients and to appreciate all of the things that the patients have to experience. Something as simple as receiving the news on, a test, being a little bit more empathetic about what's going on. I don't think that I have not been empathetic, and I think I've done a good job at communicating properly with my patients when it comes to giving them that kind of information. But I'm definitely going to have a lot more pause in the manner in which I do it, simply because of what I've been going through now. And to be a little bit more empathetic when your patients go through an injury or an illness and they have to be off work for so many months. I have a greater appreciation for people who have chronic pain issues, who aren't able to care for themselves appropriately without help, or something as simple as I can't get around town anymore by myself. I have to rely on someone to take me to do small chores, and how stressful that makes my life. It's small potatoes compared to the greater scheme of things, but it's a piece of stress in my life that I have a greater appreciation for now.
Yeah, definitely. We should probably dive into that on future programs, because these next 6-8 weeks, longer, maybe shorter, hopefully, you're going to have these, little things that come up that I know you'll talk about on social media and share on Snapchat and your blog and stuff. But, I mean, it's so trite to say, and it's things that we take for granted. But when you do go through that, we'll be able to, one, appreciate it more, and two, appreciate our patients and family members as they go through similar situations like this.
Yes. So, Mike, thank you for being a guest, and you kind of ran the show on this one here. I talked a lot, but I was the storyteller. You were the interviewer. so I appreciate that. For those of you who don't know, for those of you who are joining my podcast, first time fan or longtime follower, my guest, Dr. Mike Sevilla. See, I did it again.
Either way, doesn't matter.
I did it again. Dr. Mike Sevilla. I'm going to get it right. Dr. Mike Sevilla. Mike and I have known each other for greater than almost 10 years now through social media. Mike and I met what Janet has coined as BFBT, before Facebook and before Twitter. when all you had was blogs out there. Mike ran the blog Dr. Anonymous, very highly publicized, highly popular physician ran blog. He also is one of the podcasting pioneers before podcasting was cool. He still, I think you're reviving your podcast. Is that right, Mike?
I'm having some scheduling difficulties. Life gets in the way, and so yeah, I'm trying to get back in things. So, but yeah, people can find it.
Yeah,
all my stuff is at drmikesevilla.com.
So yeah, everybody can find anything and everything about Mike over at drmikesevilla.com. He's on Twitter at Dr. Mike Sevilla. He's on Facebook. He has his podcasting there. He has some of his recent public, what's the word I want to use? Public speaking gigs on there. What's the last speaking gig you did there, Mike?
I don't know, but I was interviewed on local TV, which I'm very proud of. So
yes, tell me about that. We can talk about that. We're going to extend this. You can tell me about that.
So actually they called me at a couple days ago, and they said, "Hey, can you? We're doing a story on can cold weather cause colds?" And I was like, "What?" And I was like,
"Is that a thing?"
I was like, "I'm going to be on TV? Sure, I can talk about it."
Nice.
So
and that was on a local news channel, right?
That was on local news here, soon to be picked up nationally. No, I don't know.
Yeah.
So yeah, people can check it out at drmikesevilla.com. I won't give away the ending. You can go check it out there. People are I'll get all the hate mail too.
Yeah. For those of you who have hung out this long on this very long and extended podcast, I thank you for hanging out and surviving. This has been the Change of Shift podcast, where nursing meets the internet. I have been your host, Shawn Dent. You can find our podcast at thechangeofshift.com, and you can find everything you need to know about me at shawndent.com. Change of Shift podcast is a podcast where we are out to solve problems, review topics, and share actionable information that encompasses the professional and personal lives of healthcare professionals and nurses. Please subscribe, download, and listen while we discuss current events, impactful stories, and invaluable lessons from the front lines of healthcare. Thank you for listening. And as always, check your own pulse first.